Hello, I'm Dr. Becky Lynn, and I am here in Tokyo. This is the Tokyo skyline behind me, and today I'm going to talk about the importance of getting tested for sexually transmitted diseases. We all think it won't happen to us. That you would have a lot of symptoms, you would know exactly what you have, or you would avoid those people who have sexually transmitted diseases. Unfortunately, it's not that easy, and there are several diseases where you might not even have symptoms when you get it. So let's talk about chlamydia first. If you are 26 or under, you should be screened for chlamydia no matter what, even if you don't have symptoms, because chlamydia is bacteria and it's gotten through sex. And it can scar your tubes. And you may walk around with chlamydia for a long time and not even know it. You don't have a discharge, you don't have symptoms. But the problem with getting chlamydia is it can cause scarring in your tubes, which can prevent you from getting pregnant. But also, if you get pregnant, then it increases your chances of that pregnancy ending up in the tube, and that's called an ectopic, and that's an emergency. A baby can't fit in a tube. The tube is the size of your pinky finger. That's about it. And the baby can grow, it can burst, you can bleed into your abdomen, you can end up losing your tube. And so it's a real problem. The other thing that chlamydia and gonorrhea also and sexually transmitted diseases tend to do is they can get up into your uterus, into your tubes, and into your ovaries, and you can end up with a tubo-ovarian abscess, or what we call a TOA. And nobody wants to have that because you're very sick. It's a big bad infection. You have to be admitted to the hospital. You have to get antibiotics through your IV, so going through your arm. People tend to have a lot of abdominal pain that goes along with it. That's usually how it presents, with abdominal pain and fever, sometimes a discharge, sometimes not. And people tend to be very sick. We usually treat that with IV antibiotics also, but if that doesn't work, or you become very sick, or you develop what we call an acute abdomen, where there's just so much infection in the abdomen that it can get in your bloodstream and make you very sick, then sometimes we need to go to the operating room and remove a tube, or a tube and an ovary. And it's always better to have your own tubes and your own ovaries. Yes, you can still get pregnant if you have one tube and one ovary. But you never know what's going to happen to that other ovary. So really, I guess the main point is that you really want to avoid getting any sexually transmitted diseases. Chlamydia and gonorrhea are the most common findings in women with tubo-ovarian abscesses, or PID. And PID is pelvic inflammatory disease, and that's just when the infection gets up through your cervix, into your uterus, into your tubes and ovaries, but hasn't formed an abscess yet. I started off talking about chlamydia, which is something that everybody, if you have a new sexual partner, if you're having unprotected sex, everybody should be screened for this. And like I mentioned, chlamydia doesn't always have symptoms. Gonorrhea, on the other hand, tends to have pretty bad symptoms. Women have a copious, thick discharge, can be yellow, it can be greenish. Gonorrhea definitely tends to have more symptoms, but it does the same thing as chlamydia. It gets up into the uterus and the tubes, can increase your risk for having an ectopic pregnancy. You can end up with a tubo-ovarian abscess, and all sorts of bad things. Ultimately, you can end up with a hysterectomy if the infection is bad enough in the pelvis. So when you have sex is fun, it feels good, it's wonderful, but it is really important to protect yourself against getting these sexually transmitted diseases. Not only chlamydia, gonorrhea, but HIV, hepatitis, herpes. Nobody wants herpes. I'll talk a little bit about herpes. Herpes is a virus, whereas chlamydia and gonorrhea are bacteria. And the problem with herpes is that it's not really treatable. Herpes is, once you get it, then you have it for life, and you can always pass herpes to a partner even if you don't have an active outbreak. So that's a tough one. Herpes is something that if you have sex with somebody, you need to be telling them that you have the herpes virus, because you can pass it along at any time, and that's called asymptomatic shedding. Herpes is a virus that gets in the nerves and causes little blistery type vesicles, and they can occur in the vagina, they can occur in the cervix, they can occur on the vulva, they can occur down by the anus, and it's not so pretty. So the best way to protect yourself against the herpes virus is also safe sex. So chlamydia, gonorrhea, herpes, you always want to wear a condom. That can be a male condom. Have your partner wear a condom, and he's not worth it if he refuses. No matter how much you want to be having sex, it is not worth a lifetime history of herpes. So just let that go through your mind when he's saying, or you're thinking that you don't want to use a condom. So it's really important to have your partner wear a condom, or you can wear a condom as a woman. So men can wear condoms and it protects them against sexually transmitted diseases also. And there are female condoms. They look kind of like male condoms, but they're bigger. And that's because the vagina is just a long hollow tube. And so it's more like this, and the condom fits all the way in that tube to protect yourself. So don't be fooled. Sexually transmitted diseases are a big deal. The final one I didn't really mention, there are many. There's syphilis, there's hepatitis, trichomonas, all these other things you don't want to get, but you also don't want to get HIV. And HIV is the virus that causes AIDS. And HIV affects the immune system, and it's another one that never goes away, kind of like herpes. But if you don't have an intact immune system, then you can't fight infection. And people who develop AIDS, which is a full-blown infection of the human immunodeficiency virus, they can't fight off infection. They get all sorts of infections that a person without AIDS would not get, because if you have a good immune system, you can fight those off. So you end up with rarer types of infections, and you can also end up with cancer. It's called Kaposi sarcoma, and it's related to the AIDS virus. It's another thing that you always have to tell your partner, whether you're male or female, that you have something like that, and you always have to protect yourself with condoms against acquiring these diseases. Don't be fooled by, oh, he's a nice person, or oh, she seems clean. It's always best to, if you have a new partner, go get yourself checked, go to the doctor, be screened for sexually transmitted diseases, have your partner be screened for sexually transmitted diseases, and that way both of you can be treated, and do this before you decide to have sex. I can't tell you how important this is and how many heartaches we can prevent by treating for sexually transmitted diseases. So enjoy the view of Tokyo. Tokyo's a great city. I've had a fantastic time here. I highly recommend that you come visit. It's been an amazing trip. We also loved Kyoto, so take a view. This is the view from the 53rd floor of our hotel, and we'll see you soon. Bye-bye.